Hello there, my name is Emily. I'm going to be your student nurse today. Can you please tell me your full name and your date of birth?
Tommy Hall, March 21st, 2000.
Perfect, thank you. I'm here to perform a full assessment from your head through your peripheral vascular, okay? It should take about 20 minutes. Is it okay if we proceed with the assessment?
Yeah.
Okay, fantastic. So I'm going to start off with a couple silly questions. Can you tell me where you are right now?
In the hospital.
Okay. And can you tell me the date or the day of the week?
Thursday.
Sure. And what time of day is it?
7 o'clock.
Okay, great. So I just make a note that my patient is dressed appropriately. The mood and the affect is normal. His eye contact is appropriate. His ability to follow commands is appropriate, and his speech is clear and coherent. He has a normal appearance. He's otherwise appropriate looking, and his nutritional status looks appropriate. His vital signs are stable, and his BMI is adequate for his height and his weight. Do you have any allergies?
No.
Okay. And are you having any pain today?
In my arm.
Okay. Can you tell me when that pain started?
This morning.
Sure. Can you point to where it is for me?
Right here.
Good. And when you have the pain, does it last a long time, a short time?
Short time.
Okay. And is it dull, aching? Is it sharp, like a stab?
Aching.
Okay. Is there anything that makes that worse?
No.
Anything that makes it better?
Mm-mm.
Okay. And have you done anything to try to treat it?
No.
Okay. All right. So we're going to go ahead and get started with the assessment if that's okay. I'm going to start by taking a look at your skin, hair, and your nails. So I just make a general overlook of your skin. It looks even in color. I don't note any lesions. It does look like you have some nevi scattered. Those are just freckles, so that's normal. None of them are raised. They're smaller than 6 millimeters. And then if you could just stand up and turn around so I could take a quick look at your back. Perfect. So I noticed nevi on your back as well, but none are more than 6 millimeters and they're not elevated, so that's not something of concern today. So you can go ahead and have a seat. Thank you. I'm going to take a look at your nail beds and make sure that they're smooth and shiny. There's no divots, no discoloration, so those look normal. The capillary refill is less than 2 seconds. I'm going to also take a look at your hair. It looks evenly distributed. I'll just take a look at your scalp. No skin problems noted on your scalp. No inhabitants, so that would be like lice or other bugs living in your hair. So there's none of that. I'm going to also just take a quick feel for your temperature. Your skin temperature and moisture. So I'll do that on your arms. It's even throughout. It's warm and dry, so that's good as well. I'll get a general appearance of your head. It's normal in shape and size. We call that normocephalic. I don't see any gross deformities or lesions. No obvious lumps or bumps. I already looked at your scalp. It looks even in color. Your face is symmetrical, no gross deformities or anything noted on your face. I'm going to go ahead and feel your head, okay? So I'll just feel for any lumps and bumps. I don't feel anything there. I'm going to go ahead and palpate your temporal arteries here, and those feel nice and strong on both sides. I'm also just going to feel for your sinuses, okay? So I'll feel maxillary and frontal. Is there any pain or tenderness when I do that?
No.
Okay, good. Good. So now I'm going to just do some cranial nerve assessments. Okay, so we're going to start with the cranial nerve number 5, which is the trigeminal nerve. So the first thing I'm going to have you do is I'm just going to place my hands on your cheeks. I'm just going to have you clench down for me. Good. And now I'm going to have you close your eyes, and I'm just going to, this is the sensory portion, so I'm just going to touch your face lightly on either side 3 times, and I just want you to tell me when I'm touching. You can just say now.
No. 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 No.
Good. So that's for the trigeminal nerve number 5. That's intact. I'm also going to assess your cranial nerve number 7, which is your facial nerve. So I'm going to have you do some funny faces. I'm going to have you smile big for me, and then frown, and raise your eyebrows up, and squeeze your eyes really shut, and then blow your cheeks out for me. Good. All right. I just note the appearance of the palpable fissures. They're even on both sides. They look normal. I notice that your eyebrows and your eyelashes are well distributed. There's no gaps. I'm just going to have you look at me. I'm just going to pull down. Note that your conjunctiva is nice and pink and your sclera is white, so that's good too. And then I'm just going to go ahead and palpate the lacrimal apparatus up here above your eyes. Is there any pain or tenderness when I do that?
No.
Okay, good. So that's just a duct, and pain or tenderness can indicate that there's a clog there. So that's normal that you're not feeling that way. We're going to do your cranial nerve number 2, the optic nerve. So this is when we're going to do the visual acuity. So the chart you see in front of you, I'm just going to have you cover one eye for me, and then just read the farthest line down you can.
ABC.
Very good. And then I'll have you switch sides for me and do the same thing.
ABC.
Very good. So I would note that the patient's vision is 20/20. That means that you can see at 20 feet away what the average person can see at 20 feet away, okay? I'm also going to test your peripheral vision for that cranial nerve number 2, the optic nerve, okay? So I'm just going to have you cover one eye again. I'm just going to kind of come from behind you, and I just want you to tell me when you can see my fingers.
No. Yeah. Yes.
Okay, and I'm going to have you switch sides for me.
No. No.
Okay, good. I'm also going to test your cranial nerves number 2 and 3, which is your pupillary response. So I would just have my pen light here. I'll have you look straight at me, and I would just look good on both sides. And I would note that the pupils constrict in direct light, and they are equal and reactive and round on both sides. I'm also going to do the test of cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens nerve. So I'm just going to have you follow my finger. We're going to go up and then down, side to side. Good. Good. So that shows me that those nerves are intact as well. Good. So now I'm just going to take a quick look at your ears, okay? I'm just going to feel, do you have any pain when I do any of this?
No.
Okay, good. I'm going to pull the pinna up and back and take a look with my light, and note that the tympanic membrane is pearly gray in color. I don't see any drainage, no foreign objects in there, so that's good. On your left side there, I do see the tympanic membrane the cone of light at 7 o'clock, which is normal, and I would look on the other side and we would see that at 5 o'clock as well, on your right hand side. To test your ears, we're going to do something called the whisper test. This is for your auditory nerve, which is the cranial nerve number 8. So I'm going to stand behind you, and I'm going to have you cover one ear. Just plug it right there for me. And I'm just going to whisper you a series of letters and numbers, and I would just like you to repeat them back to me, okay?
A1B.
Very good.
D3F.
Good. All right, so that shows me that that cranial nerve number 8, the acoustic nerve, is intact. I'm now just going to take a quick look at your nose, mouth, and your throat. We'll go ahead and we'll start with your nose. It looks symmetrical. I don't know any drainage. I'm just going to have you kind of push the tip of your nose up, and I'm going to use my light to look at your septum. It looks midline. There's no deviation noted there. I would also use my light to look up inside your nose and note that I can see your inferior turbinates. The mucosa looks red and moist. Now I'm going to just check the patency of each of your nostrils, okay? So I'm going to have you plug one side and just take a nice deep breath for me, and the other side. Good. And now I'm gonna have you close your eyes. You're gonna plug one side for me, and I'm just gonna hold a scent up to your nose, and I'd like you to tell me what you smell.
Peppermint.
Good. Okay, and so you can switch for me, and this scent now.
Vanilla.
Okay, very good. All right, so that's for the cranial nerve number 1, the olfactory nerve. So that shows that those are intact. I'm just gonna take a look at your mouth. I don't see any lesions, nothing abnormal in your mouth. It looks symmetrical and even on both sides. I'm going to have you just open up your mouth for me. I would use my light to look at your tonsils. I know that they're a 2+, so that's normal. I'm going to have you open up again. I'm going to look at your buccal mucosa. That looks pink and moist. If you could lift your tongue up for me so I can look underneath. Good, that also looks pink and moist. No lesions noted there. And then I'm just going to have you place your tongue down, and I'm just going to have you say ah for me.
Ah.
Very good. So I notice that the soft palate rises with the uvula, which is great. That also shows me that the cranial nerves number 9 and 10, the glossopharyngeal and the vagus nerve, sorry about that, are intact, which is great. I'm also just going to have you stick your tongue out like this at me. Good. So I notice that your tongue is midline. It looks like the dorsal surface of your tongue has a little white coating on there, which is normal. It looks pink and moist, which is great. It looks like that hypoglossal nerve that we tested when you stuck your tongue out looks like that's intact because it's nice and midline. Great. All right, so we're going to move on to your neck now, if that's okay. So you'll still be seated here. I'm just going to look at it. It looks symmetrical. I don't notice any gross deformities on your neck. I am going to have you look up and down for me, up and down, and then look side to side for me, and then ear to shoulder and ear to shoulder. Very good. So it looks like you have good range of motion in your neck there. I'm going to test your cranial nerve number 11, which is your spinal accessory nerve. So I'm going to have you shrug your shoulders against my hands and then turn your face against my hand and this way as well. Great. Okay. Now I'm going to palpate your lymph nodes. Okay, so we'll start on your face here. This is the preauricular and the postauricular, and then the jugulodigastric, the submandible, the submental, the anterior cervical, the posterior cervical, and then the deep cervical, your supraclavicular and infraclavicular nodes there. And then I'm just going to have you raise your arm just a bit for me. I'll feel the central here, the lateral here, and the subscapular in the back here. So I don't know any tenderness or swelling of those nodes. They feel soft and mobile. And did you experience any pain or tenderness when I palpated those?
No.
Very good. Okay. So now I'm just going to do a quick assessment of your lungs and your chest. So I note that the breathing is normal and non-labored. The perfusion looks good. Your skin color is even. Your shoulders are symmetrical. It looks like you have good musculoskeletal development. I'm going to just have you spin around for me if you don't mind. Let me see your back. I'm just going to feel down your spinal process, and you can just tell me if you're having any pain with this.
No.
Okay, and then I'm going to palpate your paravertebral muscles. You can tell me if there's any pain with that.
No.
Okay, good. Now I'm just going to have you say, I'm going to place my hands on your back, and I'm going to have you say the words 99.
99. 99. 99. 99. 99.
Good. So that was the tactile Fremetis test. That can just show us that does resonance inside of your lungs. So if it was uneven or if it felt different on one side versus the other, then that would be a concerning thing, but it feels very good. I'm now just going to place my hands on your back here, down by T9 and 10, which is down by the bottom of your rib cage. I'm just going to have you take a nice deep breath for me. Good. So my hands expand and come back together evenly. So that looks normal as well. Okay. Now I'm just going to test for CVA tenderness. So I'm going to just place my hand over your kidney here, and I'm just going to give you a light little punch. Any pain or tenderness when I do that?
No.
Okay, very good. Now I'm going to take a listen to your lungs on the back using the 9 spots. I'll just have you take a couple deep breaths. You don't have to take a deep breath for every single one of them. So I'm just going to take a listen here. And we'll use the ladder formation to go in all 9 spots. So this is 2 and 3, 4, and 5, 6, 7, 8, and 9. Good. So I don't hear any adventitious lung sounds, no wheezing, no rhonchi. They sound equal on both sides. I may also test for agophony, bronchophony, and whispered pectoriloquy. Agophony, I would have you say E, and then bronchophony, I would have you do the 99 again, and then for whispered pectoriloquy, we would do the 1, 2, 3 whisper. So I'm going to have you turn around and face me again. I'm going to just take a look at the front of your chest. It looks like your breathing is non-labored. I would also feel for any like gross deformities, any abnormalities there. Sorry, that was a little bit hard.
No, it's just tickling.
I would also listen to the front of your chest and the 5 spots, so I'd have you take a couple more deep breaths for me. So it'd be 1, 2, 3, 4, and 5. Good. No adventitious sounds noted there. They sound equal on both sides. Now I would have you switch over to the bed if you don't mind. You're gonna lay flat on your back for me, and I'm just gonna have, yeah, you can just like scooch. No, go this way. Yeah,
My feet towards you or my head?
Yeah, please. If you don't mind, that would be fantastic. Thank you so much. I'm going to just take a listen to your heart. Note any pulsations on your neck. I don't note any distension. I see the pulsation here at the suprasternal notch. I am going to just take a listen to the aortic, the pulmonic, the Erb's point, the tricuspid valve, and the mitral valve. I would also palpate the carotid arteries. I did this a little bit out of order. Doing 1 on each side. I would listen for any bruits using the bell of my stethoscope at the angle of the jaw, the mid-cervical region, and the base of the neck. And I don't hear anything there that would indicate some sort of blockage. I'm going to have you, so I would listen with my diaphragm, and then I'd have you lay on your left side for me, please. And I'm going to listen again at all 5 spots using the bell of my stethoscope for any murmurs. So I would listen at the mitral valve, the tricuspid valve, Erb's point, the pulmonic valve, and the aortic valve. And I don't hear anything abnormal there. So then I'll have you lay on your back again for me. We'll do a quick assessment of your abdomen. Okay. So I would just look at your abdomen. I note that the umbilicus is present and midline. I would go ahead and percuss the abdomen. I'm so sorry, I know it's not the most comfortable. Oh, actually, nope, I'm gonna listen first, because if I percuss or palpate first, then it could increase your bowel sound. So I'd listen in the lower right first, the upper right quadrant, the upper left, and the lower left. And I would note that I hear bowel sounds present in every quadrant. If I didn't hear them, I would listen for 5 minutes to determine that they weren't there. I'm also going to take a listen to the aorta, your renal arteries, your iliac arteries, and I would also listen to the femoral arteries, which are down in the groin area. Now I'm just going to percuss, and I would note dullness over, sorry, I understand this can be a ticklish process. I would note dullness over solid organs and tympany over hollow organs. And then I'd go ahead and palpate. Do you have any pain when I do that?
No.
Okay, great. You can stay just like that for me. I'm just going to take a quick look at your peripheral vascular. So I'm going to palpate all of your, so I note that your color is good. I would look for edema on your legs, and this is when I would do, I would feel for the temperature and moisture of your lower extremities. They are normal and dry. I don't know any edema on your legs, but if I did, I would push down on it to see if it was pitting. I'm going to palpate all of your pulses, so we already did the carotid, but I'm going to go ahead and do radial, and I'm on both sides, ulnar on both sides, brachial on both sides. I would palpate your femoral pulses on both sides, your popliteal pulse, your posterior tibial, and your dorsalis pedis pulse. I would also test capillary refill. We did this earlier on your fingers and then on your toes. Great. So everything looks normal. Is there anything else that I can do for you on here today? You can